everyone, Tuesday night, 7 p.m. and we are doing our monthly extended Facebook Live. Welcome, I'm glad y'all are here. Before we jump into a bunch of stuff, I wanted to ask you a couple questions just to kind of throw some stuff out there. Why is it normal? I've got some notes as usual. Why is it the norm to see our kids, girls specifically, all of our kids, but girls specifically, stressed out all the time with school, home, athletics, body image, social media, friends, whatever it is, right? So our girls are struggling with a lot of stuff. We tend to see the anxieties more in the girls. The girls tend to go inward and get a lot more anxiety and frustration turned inward. Like I said, body image, how they feel about themselves, what their friends think about them, all of that stuff, right? As girls and women, we've all been there. We've all went through that phase at some point. For some folks, it lasts a little longer. For some, it's early on. But we're seeing this in our girls, and we're seeing it younger and younger and younger all the time. They're struggling with their homework, and then their grades drop. They want to play sports well, but they're struggling on their team, or they're struggling to learn new skills, right? This is very frustrating. They have low self-esteem and body image, and they may not be sleeping. They're constantly fighting colds and flus. Just this general dis-ease in our girls, and especially with our girl athletes. Although playing in sports for our girls is awesome, and it's recommended that they do something of that sort. I found a quote here. Let me see. Exercise is essential for all children, but girls get special benefits from playing sports. Girls who play sports do better in school and are less likely to smoke and get breast cancer later in life than girls who don't participate in sports. Most commonly for girls that you'll see them swimming, soccer, gymnastics, and softball. Those are the most common things. But like I was saying earlier, we're seeing this new normal with our girls, right? And just because something's common doesn't mean it's normal. If you've been in my office, you've heard me say that once. You've heard me say it a bunch of times. We say it with ear infections. We say it with tonsil stuff. We say it with the colic and the reflux. We say a lot of this stuff. Just because it's common doesn't mean it's normal. So just because our girls have a lot of anxiety and stress, and a lot of them do, that doesn't mean that that's normal, okay? So it's something that we need to do about that. What if our girls were more resilient, adaptable, emotionally stable, they had more self-esteem? So I want you to think about this. And I know just from my personal experience, so those of you who don't know me, my name's Thea Taylor. I own and operate Taylor Sport Chiropractic. I'm a chiropractor. I offer tailor-made health care for active, committed families, and I am your pediatric chiropractor. And this is what I've been doing for the last 12 years. For the most part, I've had a sports medicine practice over the years. I also owned a gym. I was a nationally ranked Olympic weightlifter at one point in my life. I actually won the nationals at one point. So during my high school years and early college years, I was working, going to school. I was training hard. So I was doing a lot of things that would have been in the late 80s and early 90s. So you can figure out how old I am. But I know what it's like to go through that. I know what it's like to want to train at a high level and struggle. I know what it's like to work against the norms, if you will, in society, and women who are athletic and strong and trying to, go to school and work and do all this stuff. So I understand what that's like from our young ladies' point of view and from our girls out there. So this is a topic that's very near and dear to my heart, and I love to help kids. So I've been an athlete. I've also struggled with ADD, mostly ADD, some ADHD. I've struggled with dyslexia in my life terribly. and then a lot of stuff as a kid that I struggled with, and so forth. So I understand what it's like to deal with these things and try to deal with them in a non-pharmaceutical, natural way. And that's why I'm so passionate about this. Part of my big goal for 2019 is to help as many kids as possible. So tonight I want to talk about kids and sports. We're going to talk a lot about girls, but we're also going to be talking about boys. A lot of this stuff you can transfer over to the boys as well, and we can go from there. With all that said, there's an alarming number of female athletes with chronic health conditions, right? They were once people, so the athletes, these gals, they were once people who were the pinnacle of health and performance, but now they are the opposite. Instead of ignoring this reality, we need to address the causes. So I want to address some of these things tonight. Although this is a little bit of an extended Facebook Live, it's probably going to run till 7:30 or 7:40, kind of somewhere in that area. Sorry, trying to fix my chair. As usual, I've got my weird little dark setup, so I hope it's working for you out there. We'll kind of see what happens as we progress through here, and we'll work out. But yeah, so a lot of times we can be really, really fit, we can be really, really healthy, but then at some point we turn, right? At some point something happens, and maybe we can work on digging out what whatever that happens is, and maybe help some folks out there. So the first thing I want to dive into tonight is our health and fitness curve. I talked about this, I think, last week on a Facebook Live that I did, just like a little preview. And so I wanted to jump back in here again, and I want to run through it a bit. So you can see here, this is our fitness level, this is our health level. Now, we can take this from somebody who is maybe not very healthy and doesn't have a lot of fitness, right? Somebody who's trying to get back on track, and they tend to start down here, right? Down in this corner, and they go up. What's interesting about this is that the health and fitness line will go together. It stays right together, and it goes up. So as your fitness goes up, your health goes up. As your health goes up, your fitness goes up. A lot of times these people, these folks, it could be a young adult, it could be a mom, this could be a younger person. You could say that as they go along, their health and their fitness go together, right? But then something happens, right? We go along, and there's actually a sweet spot in here where everything is at a really, really good point. Their health and fitness are on cue, they're sleeping well, their mood is good, life is good. They've got the balance of, their cheat meals, all this kind of stuff. Everything is just pretty much dialed in. And then what tends to happen is they continue on their fitness journey. Now, like I said, we wanted to talk about the girls, so let's start there. So this could be a high school swimmer or track athlete or volleyball gal. It could be any of these gals, right? And they're going along and they're playing really good sport. And everything's going great, and they're getting stronger. The coaches like them. Everything's happening for them, right? And then, but we add in all these other stresses. So what could the other stresses be? There's all kinds of outside stress. There's peer pressure for these girls. There's just life, right? They got their life stuff. They got grades, family. Maybe they're trying to work. Maybe they are having low self-esteem or body images. Some of this stuff may come along about this age, although that, like I mentioned early on in the talk, that happened really, really early, right? So for these girls, it's getting younger and younger. That's what I'm trying to say here. So we're going along, we're healthy. So for these gals, since they're young and they're growing and they're getting stronger, they haven't even hit their peak yet, right? Like, so a high school athlete hasn't even hit their peak yet by any means. But you throw in some of these other things. So like we were talking about, these added outside stresses, you might see a decline in health with that. They may get into overtraining. Overtraining for these girls is interesting because a lot of times they're doing not dual sports, but they're playing for 2 leagues at the same time. So you'll see the softball gal who's playing softball for the school, but it's also playing select. You see this with volleyball as well. So the volleyball girls, they'll be playing select and they'll be playing high school ball. So they're trying to do both. That's where we see that the problems come in, right? And they're worried about their grades, and they've got family issues. Some of them are even trying to work a job. Like, they've got a lot of stuff going on, and they're going to miss this sweet spot. And that's when the health starts to decline, okay? So this is kind of what we need to keep in mind. If we go a little older, college girls, same thing. They might be playing sport. They might be trying to get in shape. At first, everything's going along the same line. They hit the sweet spot. Body looks great. They're performing well. Maybe their grades are good. They're doing well on their job, whatever it is. Their social life is happy and active. But then something happens. Some sort of outside influence comes in, and then they get too much stress in the system. And again, they start to decline, where their health will actually go down, okay? I want you to think about some of this stress stuff like a backpack, right? So you put on a backpack, and we're going to fill it with stress. So each time we have stress, I want you to throw a rock in the backpack. And I want you to think about yourselves as well. I want you to think about your backpack of stress as we move through the talk. And I want you to think about how much stress goes in versus how much stress comes out, right? Some stuff, it may seem like one rock of stress, but really that's two. And then what are you doing to take the stress out of the backpack, right? So think about that. Are you doing self-care? Are you getting massages? Are you eating well? Exercise may be self-care for some people. For other people, it's not going to be such a good thing, right? So it depends on where you are on the line, right? It depends on where you are here and what you're trying to do. If exercise is stressful, like, I'm going to use CrossFit as an example. I'm not dissing CrossFit. A lot of you know I used to own a CrossFit gym. I love CrossFit. It's a great modality when it's used properly. But one of the biggest things I used to hear from the athletes that would come in the gym was they would show up and they'd be like, I've been so stressed out all day thinking about the workout. And I'd be like, wait a second. You're not supposed to be stressed out thinking about the workout. It should be a happy thing. You're coming here to see your friends and exercise and feel better. But unfortunately, that's not always the case. And that can be with anything. That could be someone that's training for a triathlon. The workouts will stress them out. I've worked with a ton of triathletes in my office over the years. And those folks are usually very type A, very stressed out, high-end jobs, families, the whole 9 yards. So they're throwing a lot of rocks, stress rocks, into that stress backpack. But they're not always pulling stuff out. So for them, exercise gets them up here in this elite category, right? And that's when their health starts to drop off, and they're not doing enough to relieve the stress out of the stress backpack, right? So there's a give and take there, and being aware of where you are and what you're doing is a big part of that, okay? So again, back to our college girls, right? They're playing in sport, they're trying to keep their grades up, they're traveling, like a lot of those girls are traveling, and boys when they're playing, and so they've got all that added stuff in there. Some other things that we'll see with this is we're going to see a decline in performance. So they want to perform well, but they're struggling with it. They want to learn the skills and get the base skills down, but they can't. They're having trouble with it, right? So they're going to go down, and then you're going to see mood and depression issues. What's interesting about this mood and depression thing is that women, I found some stats here for you guys. Overall, in each age group, females were about twice as likely as males to take antidepressant medication. So 1 in 4 ladies out there and girls in all age groups are on some sort of antidepressant medicine. What's up with that, right? When did this become okay? Just because it's common doesn't mean that it's normal, right? So let's remember that. Let's make that separation in our head. So 1 in 4 women. Just some other stats I found. 11% of kids have ADHD. That's what the CDC says. 1 in 5 kids have a diagnosis, and 1 in 10 kids are on medication. I think those are actually kind of low numbers. I would bet that they're actually a little bit higher from the stuff that I'm seeing in the office. All right, let me go back to my notes here. So yeah, So this is super important. A lot of people don't realize this. People think the fitter I get, the healthier I'm going to be. And that's not necessarily the case at all. And just because, you know, you think your function or think your fitness is good, it doesn't mean that your body is functioning well, right? You may feel good, but that doesn't mean your body's functioning well, right? So we need to make sure that that is the case, that not only do you feel good and look good, but you also function well. And that's where a lot of this tipping point comes from in here. And this is huge. Find your sweet spot and try to hang out there. That's maintenance, right? That's going to be our maintenance spot. So what else can we tell you here? So a lot of these gals are being trained. So our youngsters, they're being trained like the boys, right? So there's no separation in how they're trained. So the lady soccer players are trained the same as the men or kids, or excuse me, boys soccer players. The women CrossFitters are training the same as the men CrossFitters, right? The gymnastics, the girls gymnastics team is training the same as the boys gymnastics team. Women's bodies take impact, training, different things in a much different fashion. Our hormones take a beating in a much different way than men's do. That doesn't mean we shouldn't compete. Compete, go after it, go get it. But just be aware of these things, that our bodies handle things differently than men. In some ways, we handle them better, but in other ways, we don't. So it's kind of an interesting thing there. It's interesting, too, because when we are being coached, a female, a lot of times, can take coaching as a criticism, right? Females hear criticism while males hear possibility. Right? So a lot of times if coaches are telling us that we're not doing things right or they're trying to fix it, they're taking it as criticism. A lot of females do, whereas men tend to take it more as, I have somewhere to go, I can fix this, and so forth. So having a coach and someone around you that can coach you appropriately is super important. So words are super important. Remember, there's 3 things that cause problems in the system, that cause dis-ease. Traumas, toxins, and thoughts. That's this over here, traumas, toxins, and thoughts. And these 3 things cause problems in the system. These are more stressors, right, going in our backpack. So we have the stress going in the backpack, but how is the stress coming out of the backpack, right? Traumas are going to be super important. They're going to be injuries, falls, overtraining, stuff like that. Toxins can be anything from actually ibuprofen, aspirin, you know, anti-inflammatories. Those can be toxins. We've had several kids in the office over the last couple of years, even longer, that come in with these little muscle pulls, hamstring strains, stuff like that. We dig deep on the history, and we actually find that they're on acne medicine. And I apologize, I can't remember the name of the acne medicine, but there's a couple different acne medicines out there that work really, really well, but they cause problems in the long run with muscle breakdown and sprain strains in the system. So you're getting kids that are getting injured, so they're having trauma due to the toxins of these different types of medications that they're on. So toxins can come in any way. They can be the foods that we're eating. You know, we want really good, solid, natural foods, very few processed foods, and so forth. And then what we were just now talking about with the coaching and how we're being coached, that's our thoughts. What's going in our brain and staying in there. Again, like I was saying, the girls tend to take on anxiety and depression. Girls tend to go inside, whereas boys tend to go out. So in the little kids, we see the anxiety in the little girls, and in the little boys, we see more the ADHD, spinning around, hyperactivity, and so forth. And the boys are funny. I want you to think about Dumb and Dumber. So you're saying I have a chance? So you're saying I can get somewhere, right? So it's really, really important. So imagine, moms and dads out there, imagine if the coach isn't nurturing and sympathetic to your daughter, right? And what that's doing to her brain and her thoughts, right? Now, I'm not saying everyone needs their hand held. I don't come from that school of thought. But being coached appropriately and getting with the right people can make all the difference in the world. I've had great coaches, and I've had not so good coaches, okay? So it's just something that we want to think about. That doesn't mean that the female brain isn't capable of handling stress. It just means that they respond better to specific words. So our words are important, and different types of praise. Okay, so that's super, super important. We just really need to be aware of that. And so like I was saying, the 3 T's, traumas, toxins, and thoughts are super important. And again, these are causing stressors in the system. They're causing inflammation in the system. Trauma, getting beat up, falling, overuse injuries, just general DOMS, delayed onset muscle soreness. All that stuff is trauma. It's going to take its toll in the system, causing inflammation. Toxins, the foods we eat, like we talked about, any medications we're on, huge. The antidepressants, the acne medicines, for the gals, the pregnancy medicines, birth control pills, sorry, total brain fart there. And then the thoughts that come behind this, right? So all of these are things that are causing issues in the system. With that comes our gas and brake pedal, okay? So this is super important. This is something we talk about with everyone that comes in the office, is that, again, this is our traumas, toxins, and thoughts again. And what's happening is that when we get into this, we get into that sympathetic mode. When we're up here, when we're past our sweet spot for some reason, when we're in this area, we are now in sympathetic mode, right? When we get up in here, we're in sympathetic mode. Our foot is on the gas all the time, right? Even one of my kids that comes in, he wrote pedal. I wrote gas versus brake pedal, and he wrote to the metal. So our foot is to the metal, right? Pedal to the metal on these kids, and they're just go, go, go. They're in full-blown sympathetics. It's like you're being chased by the bear all the time. And you know what's interesting about that, y'all, is that's important. When you go out on the soccer field, or you go to do a CrossFit workout, or you're going to go do a triathlon, or play volleyball, my volleyball girls I treat, you need to have some sympathetic mode. That's important when you get out on the field, but you also need to be able to control it. If you're in full-blown sympathetic mode all the time and you can't turn it off, your backpack is full of stress rocks, that's where we get in trouble. So our pedal is to the metal, we're in sympathetic overdrive, okay? And then we can't make good decisions. We are not going to digest our food well. Our immune system isn't going to be working well. This is when we're being chased by the bear. Okay, this is when we're being chased by the bear. And what's cool about this is that there's a lot of ways to get our foot off the gas. There's a ton of ways to get our foot off the gas. When our foot is on the gas too, we have a huge inflammatory response. We're going to lose focus with our academics and different things, even on the field. If you're in sympathetic mode and you can't focus on where the ball is, or how many reps you've done, or you get lost on the course, or whatever it is, you're not communicating well with your teammates on the basketball field, the softball field, the volleyball court, whatever it is, then we're going to run into trouble. And that's what we're seeing here. The little kids that play outfield and they're out there with their glove, but they're just spinning around, they're in sympathetic mode. Their foot is on the gas, and they've had an overload of the 3 T's, and their backpack is full of rocks. And we're not doing anything to take the rocks out. We're not doing anything to take the rocks out. Super, super important. Also important for the emotional health of our girls, of our boys too, but of our girls. Girls are more at risk for getting injured. Okay. Girls are actually more at risk for several of the most common injuries, including ankle sprains, concussions, and ACLs. 59% increase in ACL injuries among girls ages 13 to 17 over the last 13 years. And the incidence of ACL tears in female athletes has been found to be 2 to 10 times higher than their male counterparts. And that's for a lot of reasons. They know that the Q angle of the hip to the knee plays a big part of that. They think that there's a hormonal component, and there's actually a strength component as well. We see that in the men as well, but in the women, the hips are a little bit different shape, and there's a strength issue. So making sure that our girls are strong, making sure that they can support their own weight, and move well, super important. Again, that comes from the brain and the nervous system too. So I would ask you guys, what do you think is the most important system of the body? A lot of people will say to me, it's the heart. And I go, you're right. The heart's really, really important. But what makes the heart pump? What makes the heart pump blood? And it's the brain. It's the nervous system. That's the most important thing. That is the, excuse me, master organ. If our nervous system isn't working properly, then the rest of our systems aren't going to work properly. And one of the ways that is proprioception, knowing where our feet are in space, knowing about balance and so forth. Super, super important when it comes to that. And inflammation and so forth. So super, super important piece of that puzzle is knowing making sure that our brain is connected to our body, making sure that our muscles are strong. Remember, it's a nervous system that moves the muscles move the bones. Super important. So making sure all of that stuff is connected, making sure we've got the 3 T's are being lowered. We're getting our foot off the gas pedal, right? And we're moving out of the danger zone up here, and we're moving back towards our sweet spot. We're getting our stressors under control. Let me see what else I got here for you guys. So I have some tips in case you do get injured. I have some tips for you guys. Sleep is essential. Okay, we have to sleep. Super important. That's where our brain is going to be rejuvenated. That's when the cerebral spinal fluid gets moved around really well from the spine to the brain and the brain to the spine, so it gets very refreshed. That's when we actually learn new skills, and a lot of our neuroplasticity takes place is when we sleep. So you can practice your guitar or practice your kicks for soccer or your bumping for volleyball. You can practice all those skills, but you don't learn them when you're actually practicing them. You actually learn them when you go to sleep. And then the next day you go practice again, and guess what? You do it better. You can hit that G chord, whatever it is. If you've been learning snatch and clean and jerk, and you're going to be able to move better underneath the barbell, right? And that's because you had a really good night's sleep. If you're not sleeping because you're in sympathetic mode, you're not going to learn as well. You're not going to recover as well. And we're seeing this with our kids. Our kids aren't sleeping. They're on technology way too late at night. Moms, dads, I know it's hard. I'm not dissing you. I'm guilty of it too at times. And it's something I really have to keep track with for myself, because I have a hard time getting off of it as well. So sleep is essential. Extra protein, so your body has the building blocks to heal. That's super important. Be sure to get adjusted while during the healing process. That's really important, because again, it's going to make the clear connection between your brain and body so that the body can heal appropriately. I always tell people to work on their weaknesses if they're off during an injury. So if there's some other movement that you can do, or some other strength piece that you need, something that you've known for a while that you've needed to work on and take some extra time on, now is the time to do it while you're injured, as long as your injury allows you to do that. But we can actually come back really, really strong after an injury if we use that time wisely. Unfortunately, not everyone does that. They'll sit on the couch and won't do anything. But really, it's super important to take that time and use it wisely. You could even learn a new skill or do something different. Start to learn a new sport or a new activity to keep the brain really, really on top of things. And like I said, when you go back to your sport of choice, you'll actually do better at it. And then the one thing I tell all my athletes is, when you think you're ready to go back, and you're like, man, Dr. Thea, I could go back and play right now. I feel great. I want you to wait 1 week. I want you to wait, whoop, there's my camera. I want you to wait 1 week from that time on. Give yourself that extra week. It's super important. And I'll tell you where I heard that. It was Rich Froning. Rich Froning, the guy that has won the CrossFit Games like 107 times. I heard a quote from him, and that's what he said. He says, when you're ready, when you think you're ready to go back to training or competition, wait 1 week. So I can't take any credit for that. I give all the credit to Rich Froning for that. That's a great quote, and I believe it to be totally 100% true. All right, so doo, doo, doo. Let's address, so getting adjusted is super important. This is one of the ways that we can take the rocks out of the backpack. And what's interesting about taking the rocks out of the backpack, just like some stressors will be more than one rock going in, even though it's one activity, it might take up the room or the space or the energy of multiple stress rocks. So we need to make sure that we're aware of that. The same thing happens when we take stuff or stress rocks out of the backpack. Certain activities, certain things that we do for self-care to help us are going to actually take more than one, where's my camera? I'm doing weird here. One rock out of the backpack. So we need to make sure that we're counteracting all of these things. And one of the things that will do that is the adjustments. The adjustments will counteract more than one stress rock, right? When they're done in a timely fashion, on a schedule, and so forth. Why should we get adjusted? It's going to help with neuroplasticity. I'm going to go this side. Neuroplasticity. It's going to give us a stronger immune system. Like I said, when we get out of sympathetic mode and we get our foot off the gas pedal, then we're going to be more in parasympathetic mode. That's where we rest and digest and so forth. That's where we get into that healthy parts where we're going to sleep better, we're going to eat better, we're going to be in a better mood. A lot of this stuff, we're not going to be as sick, we're not going to have as many injuries, we're not going to feel as overtrained, we're going to feel more refreshed, okay? We're going to have a stronger immune system. Just said that. We're going to have better proprioception and better coordination. So I want to talk about this a little bit more. So proprioception is knowing where our body is in space, right? So if I have to kick a soccer ball, I have to be able to put my foot on that soccer ball and kick it down the field. That's proprioception, knowing where my foot is in space so that I can make contact with that. Coordination is the same thing. Coordination for a dancer is standing on one foot, right, and doing things like that. I'm going to move over. Being able to stand there and do stuff, right? Being able to balance, coordination, proprioception, agility, right? All that stuff comes from having a healthy nervous system. What's interesting is the studies are showing that when we do the chiropractic adjustments, it's going to stimulate the prefrontal cortex and the cerebellum, right? The prefrontal cortex and the cerebellum. The frontal cortex is perception. So being able to take in our environment and make a decision. We were talking earlier about being able to play well with the other people on the field, being able to communicate with our teammates if we need to. That's perception. Being able to know what's going on in the field, take account of it, and then have appropriate action to follow. That's the cerebellum. Okay, so when we get adjusted, it's going to stimulate the part that perceives and the cerebellum, that drives behavior. Those should be connected, they should communicate, and there should be neuroplasticity there as well. Okay, so when we do that, we also see this with our ADD and our ADHD kids, right? They don't perceive their environment very well, or they have an overperception, or they're so overstimulated here that they can't perceive their environment, and therefore they can't have proper behavior on the back end. So that's a little bit different, but it's the same idea, okay? There's lots of information coming in. We need to perceive it. We need to figure it out. What's happening here? Do I kick the ball over there? Do I set the ball over there? Where's the cone I need to turn around? I need to be able to make those connections in my brain and then be able to do the proper behavior behind that, like I said, and that's coordination, proprioception, balance, and so forth. So the adjustments help with that. I think that's super cool, if you ask me. Let's see. Better sleep, like we talked about, and then better healing and recovery. And this is true of all ages, y'all. I know athletes of all ages. I know, kids that I treat here in the office. I've got several softball girls and volleyball girls. Track right now is big. Most of the kiddos are in their spring sports right now, or they're doing athletics in school, so they're lifting heavy, training heavy, and getting ready for the next round. So being able to be in these environments and handle them well, being able to stay in our sweet spot and not get into overtraining. Now, for some people, taking this a step further, our Olympians tend to be way up here. Our really high-end triathletes tend to be up here, right? Professional athletes tend to be up here. They're not always the healthiest people. If they're on the more healthy side, then they're actually really taking care of themselves. They're really being careful about what stress rocks are going in the backpack and then what's going out. And I really like the backpack analogy because it just gets heavy, right? We all know that it gets heavy. Moms, if you're competing in something, you know that it gets tough because you're wrangling the kids and maybe you're working or you're doing housework and keeping the family together. You guys have a super important job and it's awesome. I don't know how you do it. I give you tons of kudos. So that's what we want to do, is we want to balance that stressful backpack, get you off of this gas pedal and get you feeling better so that you can perform at the highest level. And that's for everybody and anybody. Here in our office, we do run a set of scans so that we can see exactly what's going on in the nervous system, and then we can do very specific adjustments and other therapies to make sure that we're getting you well as quick as possible, and we're going right to the right areas. Okay. What else? I think that's it for now. If there's no questions or anything, I don't see any questions. I want to thank everyone for joining me. I hope this was helpful. If you hear anything on here that strikes a nerve with you, I would love it if you would reach out. You can reach out via Facebook, or you can reach out via, you can give the office a call. I'll be happy to chat with you. We treat tons of athletes here in the office. I know that from my own personal experience, chiropractic has helped me greatly. When I was competing in Olympic weightlifting, and just when I've had stressful times in my life, having the chiropractor, be able to help me with all that stuff has been just amazing, and that's partly why I do what I do. So anyway, it's Tuesday. You all go have a great night. Stay dry if you're here in the Houston area. It's wet, and I think it's going to stay this way for a few more days. Doesn't look like any sun till the beginning of next week. So take your vitamin D. Go for a walk in between raindrops. Do what you need to do to keep yourselves healthy, keep your mood up. And if you have any questions, please, please, please call the office. Thank you so much for watching, and I hope you all have a great night.